Welcome back. Today we're going to discuss disease transmission, its prevention, and management of disease exposure and bloodborne disease prevention. Starting with the basics of disease transmission in the healthcare setting. Healthcare associated infections, known as HAIs, healthcare associated infections, are infections acquired by the patient or client during the course of receiving treatment for another condition. Diseases can be transmitted among and between caregivers, patients, visitors, contractors, and anyone in the healthcare setting. Safety professionals should be aware that the mere existence of infectious pathogens does not usually result in disease transmission. Other conditions, including a reservoir, a place where the pathogens can thrive, a pathway or portal of exit, this is where the pathogen can travel, or a mode of transmission, this is the transfer mechanism, and a portal of entry, how does it get into the patient's body, and a host, the person who cannot defend itself against this infection must be present. So it takes a lot of things to have this transmission happen, but it does happen. Safe professionals should be aware that these standard precautions, such as cleaning your hands, protective clothing, appropriate equipment cleaning, as well as environmental infection control practices, such as specialized ventilation rooms, are often utilized within the healthcare setting. Additionally, safety professionals should be aware that the requirements for infection control programs, which often include the collaboration between the department, the medical evaluation, the safety and health education, and the training, as well as immunization programs, health counseling and job-related exposure and illness management are all involved in these exposure control programs. Under most programs, there is confidentiality, confidential reporting, i.e. the person says I've been exposed, record keeping, and tracking. Safety professionals should be aware that these systems are similar to the SHARPS injury tracking system required by the bloodborne pathogen standard and other laws and regulations, JCHO, et cetera. In the area of prevention of disease transmission, safety professionals should be aware that a number of agencies and organizations, including OSHA, CDC, Center for Disease Control, often work together to provide voluntary guidance as well as mandatory regulation in the areas of preventing disease transmission. Standard precautions combined with administrative controls, safe work practices, and PPE reduces the likelihood of pathogen transfer. These precautions include, and you're very familiar with them, hand washing, wearing gloves, wearing masks, wearing eye protection, wearing gowns, proper area cleaning afterwards. Make sure the bodily fluids, and go back and look at the bloodborne pathogen standard, how you clean equipment. Occupational health and bloodborne pathogen standards provide a great pathway to learn how to clean equipment. And I see that as an area really important. Never recap any needles. And patient placement, where you got them at. What's the ventilation like? What's going on? Enhanced precautions also have been developed to address all avenues of transmission, including the standard, the airborne, the droplets, and the contact. Enhanced precautions can also use isolation in addition to PPE. We're going to get this person out and away. We're going to put them in another area so they're not exposed to so many people. Of particular importance for the safety professional is the respiratory protection area. Respiratory protection standard, you're familiar with it? It's also utilized for airborne precautions. The OSHA respiratory protection standard and requirements are applicable within the healthcare setting and require strict compliance. Strict compliance, folks. Transmission of bloodborne pathogens within the healthcare setting is governed by the same OSHA bloodborne pathogen standard requirement as in any general industry. If it's bodily fluids, how you address it. It's got to be within there. You got SHARPS containers where you're putting your needles, other things. Make sure those two standards you know inside and out. The application and the frequency are different in healthcare settings And these are often challenges for a safety professional. If you think about it, I got 10 floors in a hospital. Am I going to know where somebody spills blood on the floor, they've got urine on the floor, they've got other bodily fluids? You're going to have to train your people. They've got to be able to do it. OSHA has developed and published the Bloodborne Pathogen Standard in 1991, and the standard has been effective in preventing bloodborne pathogen transmission. The primary focus, if you go back and read in the Bloodborne Pathogen Standard, was the transmission of HIV, HBV, and HCV, although other bloodborne pathogens are also included in this prevention effort. Virtually every healthcare setting possesses an exposure control plan, of which OSHA bloodborne pathogen standard requirements are a major component. OSHA requires that bloodborne pathogen exposure control plans include the following components. These are things you absolutely have to have: a method of compliance, vaccinations, post-exposure evaluation and guidelines, communication of hazards to workers, record keeping, the guidelines that you got to follow, including a log of injuries that were caused by sharps failures, exposure to sharps, needle sticks, other lacerations, other problems, anytime you're using sharps. And with new equipment, that's also very important to look at. Many compliance programs include engineering controls, such as sharps containers, using the safe needle devices that are out there, as well as administrative and work practices controls, such as no eating or drinking in the client care areas, hand washing. It's amazing how much hand washing can help out. Additionally, many plans include PPE, gloves, eyewear, etc. And when you use them, now you got to take care of them. How do you dispose of them? How do you clean them? And how are you going to manage those within the area? Of particular importance to safety professionals working in healthcare is the Needle Stick Safety and Prevention Act of 2000, which changed some of the original requirements under the bloodborne pathogen standard due to the high rate of exposures to bloodborne pathogens. The purpose of the act was to bring safer medical devices into the healthcare environment and to reduce the number of sharps injuries. The act made it necessary for employers to take an active role in identifying, evaluating, and implementing the use of safe medical devices. I would also note that the Act requires additional record keeping, engineering and administrative controls, including sharps disposal containers, self-sheeting needles, and needleless devices. Guys, you're working in healthcare, these are very, very important to you. If you work in general industry, bloodborne pathogens is still very important to you. You need to know these standards inside and out. I'm going to stop here. If you're not familiar with the bloodborne pathogen standard or these other standards identified in our discussion or in the chapters, please go to the OSHA website located at www.osha.gov. Everything we use is .gov. Thank you for your time. Have a great day.